Welcome to the next episode of The Pet Factor. I'm Dr. Jim Hosick.
I'm Brittney.
And this week we're going to be talking about hypothyroidism in dogs.
Okay.
Hypothyroidism is a chronic disease, and it results in a lower than normal thyroid hormone. And we say hypothyroidism in dogs because it's really rare in cats. There's been cases of congenital hypothyroidism in cats, and this is something that can also affect dogs and people. It's called cretinism in people. But a lot of times when we see hypothyroidism in cats, we caused it. We did surgery on their neck. They had radioactive iodine treatment. We've been giving them medications for hyperthyroidism, and they got too much. So we don't really worry about it. It's not usually a problem. If you got a fat cat, you can't blame it on their thyroid.
Yes.
Okay. The biggest thing about hypothyroidism is probably one of the most overdiagnosed diseases that we have in dogs.
Yeah.
And the problem is the tests are not very sensitive and not very specific. So we can have animals that have lower than normal thyroid hormones that are perfectly fine. And we can have dogs that have levels in the normal level that are hypothyroid. So there's a lot of things that we do when we're diagnosing hypothyroidism dogs that we're going to take into account other than just our blood tests. It's usually going to affect middle-aged dogs between 2 and 9 years of age. There's no sex predilection. You could be male or female. And it can occur in any breed, but we do see it more often in the boxers, dachshunds, Dobermans, golden retrievers. That's a big one. That's one I see a lot. Great Danes, Irish setters, miniature schnauzers, and poodles. But I've seen it in every breed dog, but those dogs tend to have more of this immune-mediated form of it. We'll talk about in a little bit here.
You know what was rare that I was really excited about, but shouldn't have been? We had a Greyhound who had hyperthyroidism.
Hypothyroidism.
Yes, hypo.
Yeah.
Yes,
And that's one of the things they talk about in the things I was reading is that some of the sighthounds, they can actually have lower than normal thyroid hormones. So these can be dogs that can be misdiagnosed, but they do get it. So it's just, they said they can have levels half the level of other dogs of thyroid hormone.
And that'd be their normal?
That'd be their normal. Yeah. But it can occur also as part of an autoimmune polyglandular syndrome, which means more than one gland is being affected, and it's autoimmune. The immune system is causing it. So it's associated oftentimes with hypoadrenocorticism, which is where the adrenal glands are not producing enough cortisol and the mineralocorticoids that control their electrolytes, the sodium and potassium. And also diabetes, where the pancreas is not producing enough insulin. So it's also known as a pan-endocrinopathy. But when we do have an animal that's diabetic and hypothyroid, we're going to be thinking that there's some sort of autoimmune process going on there. And like I said before, it can be present as a congenital disease, but that's very rare. It needs to be caught early. It can be treated and managed, but that's the most severe form that we're going to see. Primary hypothyroidism is when the thyroid gland itself is being disrupted or it's atrophying. So it's actually withering away. It's getting smaller and smaller over time. You have less glandular tissue to produce the thyroid hormone. Secondary hypothyroidism results from decreased TSH, which is the thyroid stimulating hormone produced by the pituitary gland. So the pituitary gland's in the brain, and it actually controls all the hormones all over the body. Thyroid hormone controls metabolism. The more thyroid you have, the higher your metabolism, the lower thyroid, the lower your metabolism, and that's where some of the symptoms come in. Unfortunately, the symptoms are very non-specific. You can have lots of dogs with these symptoms and they're not hypothyroid. So what we're looking for, and these symptoms are usually slow in onset, gradual. So we're looking for weight gain. Lethargy means they get tired very easily, and that can be accompanied by a mental dullness where they just don't seem to be as active or interested in things as they used to be. Exercise intolerance or inactivity, so they might get tired very easily, or they just may not want to go out for walks as much as they used to. Cold intolerance, so typically their body temperature can actually be a little bit lower than normal, and they like to be by the warm spot, so they'll sit at the sunny spot on the floor, they'll be by the heat vents or the radiator, trying to keep their body temperature up. Alopecia, which is hair loss, is a very common symptom that we see in the dogs. And it doesn't have to be they're totally bald, but usually what we'll see is it's very symmetrical. So they'll be losing hair similarly on both sides of their body. It can present with a dull hair coat. So the hair coat used to be nice and shiny, now it's dull. It can be thinner, so it may not actually be bald, but if you can see the skin through the hair, that might tell you that there's something going on with the thyroid hormone there as well.
Yep.
We also can see hyperkeratosis, which is thickening of the skin, seborrhea, which is kind of an oily feel to the skin.
Okay.
Hyperpigmentation, where their skin starts turning black or dark.
Oh.
And that's because of the chronic changes to the skin. Ear infections, very common with this. So if a dog has recurrent ear infections, I might want to check him for a thyroid deficiency.
Okay.
Rat tail.
Yes, you see
So that's
that
where
common.
you can see where the tail, losing the hair on the tail, it looks like a rat's tail. And then skin infections. Recurrent skin infections, always we're going to look for an underlying cause because they're usually not a primary problem in dogs. Then we can also see the neurological conditions that can occur with hypothyroidism. They can cause ataxia, which is sort of unsteadiness on the legs. They're not walking properly. Seizures.
Yeah.
Not very common, but that can be seen. Megaesophagus, and this is where the esophagus in the chest gets very dilated because it can't move the food down into the stomach very easily. So we'll take an x-ray and we'll see a big gas-filled esophagus. So whenever we see that, we're always going to check the thyroid. Facial drooping, which is like the Bell's palsy, where they just get a little bit of decreased muscle tone in their face.
Okay.
The head tilt and circling associated with vestibular disease can be associated with hypothyroidism. And when we do a neuro exam on these dogs, we may see slower than normal reflexes, slower than normal proprioception. That's where we check to see if they know where their feet are. So they'll know, but it takes them a little bit longer to sense that. And then one of the more severe things that can happen is they can have a snoring sound or a changes in their bark, and that's from laryngeal paralysis. So when we see dogs that have a change in their bark and we diagnose laryngeal paralysis, we're always going to check the thyroid hormone as well. Some other things we might find on our physical exam could include what are called corneal lipid deposits, or little white spots that can appear on the cornea, or a slower than normal heart rate.
Okay.
Again, it's slowing their metabolism, so it's not unusual to see that their heart rate would be slow. So in dogs, there are several causes for this. There's two causes that count for about 95% of the cases we see. About half of them are it's called a lymphocytic thyroiditis, which basically means lymphocytes, which are a type of white blood cell, are causing inflammation in the thyroid gland. And that's interfering with his ability to produce thyroid hormone. So this is what we see a lot in the breeds that are very susceptible to this. You can diagnose it with biopsying the thyroid, but it's not going to change how we treat, so we usually don't. The other cause is just atrophy, and we call it idiopathic atrophy of the thyroid gland. Idiopathic just means we're idiots, we don't know what's causing it. Yeah. Okay? And when we can feel the thyroid gland might be smaller than normal. If they were to do a scan, they can find that as well. We can also see it from follicular cell hypoplasia, which is where the certain cells in the thyroid gland are starting to decrease. So it's not the whole gland. Or infiltrative tumors that can affect the thyroid. So not necessarily a thyroid tumor, but another tumor that's invaded into the thyroid gland or metastasized there. We'll also see it as a decrease in the thyroid stimulating hormone from the pituitary gland. And that requires a little bit more additional testing. You can do a TSH stimulation test. That can be because of pituitary tumors or suppression of the pituitary gland due to glucocorticoids, steroids, from an overactive adrenal gland. So that can be the hyperadrenal corticism that we'll sometimes see called Cushing's, or from us giving the steroids to the dogs. And then the rarest form is probably iodine deficiency. This used to be pretty common in people. That would be the major reason why people would get goiters and hypothyroidism. But we've got iodine in our water and our food, salt iodinated. So you're going to get plenty of iodine in most diets. In fact, when we talk about the cats, one of the ways we have to treat them is to limit the iodine in their diet when cats have too much thyroid hormone. Levels of the thyroid hormone that can cause it to be falsely lower can be affected by a lot of things, including surgery and anesthesia, concurrent illnesses, medications. Phenobarbital has been known to do this. Sulfonamides, which are a type of antibiotic. Carprofen, which is a very common non-steroidal anti-inflammatory we'll use. Clomipramine, which is a drug used for separation anxiety. These are all been shown to lower the levels on the test, but they don't often cause clinical disease. Okay. So we might do a blood panel on a dog that's taking an NSAID and we see the thyroid levels low. Doesn't necessarily mean they're hypothyroid, so we just have to take that into account. Okay. And that's where we get some of those overdiagnosis comes into play. So in order to make our diagnosis, we're going to have to document low thyroid levels. And we're typically screening dogs with a T4 test, a total T4 we call it. And that is low in about 85% of the dogs. The problem is you can have dogs that have a total T4 level in the low end of the normal range, and they're still hypothyroid. So you could actually miss dogs with that. That's why it's only 85% sensitive. There's another test that's relatively inexpensive we can do called a TSH assay, which looks at the thyroid stimulating hormone from the pituitary. That's going to be low in about 80% of the dogs and 90% of the dogs. But normal TSH levels does not conclusively rule out hypothyroidism. So you have to take that into account too. If we have a dog we're very suspicious has hypothyroidism and we really want to tell if that's the case, the gold standard test is the free T4 by equilibrium dialysis, or ED. This is the most expensive test. It's probably about 4 or 5 times the cost of a T4 test, but it's looking at the active form of the thyroid hormone in the blood. So we've got thyroid hormones mostly bound up on the proteins. When it's free in the circulation, that's when it can affect the cells. So we're going to monitor that or check that if we have a case where we just haven't been able to make the diagnosis any other way. And we're always going to use that in conjunction with the clinical symptoms we're seeing. We got a dog that can't lose weight, it's got a thin hair coat, and the T4 is low, or the T4 is, even if it's just a little bit in the normal range, I'm still going to consider that dog hypothyroid.
I know we have some people, live for their pets just like people. They hope that it is the T4 and it's not the extra treats that they're sneaking or things like that. So it is always fun to know that you have so many other things to look for when it comes to the T4, because we have a lot of dogs that come in that gain 10 pounds around the holiday season. And they're just like, oh, it must be their thyroid. No.
Chances are it's not, but sometimes it
can be.
And one of the other things we'll see in the blood chemistry, and we talked about this during the wellness panels, is elevated cholesterol. And that's elevated 80% of the time in dogs with hypothyroidism. So if we got a low normal thyroid and high cholesterol and symptoms, that's going to be another thing that's going to push me towards doing that. Some places they actually do skin biopsies, and you can see changes in the skin that are very consistent with this low thyroid, glandular changes in the skin. But that gets expensive too. So typically, one of the easiest things we can do is a response to treatment. We have a dog, we're very suspicious. It may not be definitive on the blood test. We'll put them on thyroid hormone. If their symptoms get better, their thyroid levels come back up to the high end of the normal range, then we've made our diagnosis. The really funny thing that happened with the free T4 by ED, when I was in my internship, there was a client that was having their dog in the hospital and was getting a lot of these free T4 by ED tests, or by ED by ED. And at the end of the time when she got the dog back, she wrote a really nice letter to the staff saying, I want to thank everyone for taking so really good care of my dog. And I also thank Ed for all those free T4 tests he did.
Good old Ed.
Okay. Treatment's going to be pretty easy. It's oral thyroid hormone supplement. It's going to be a twice a day for the dogs. It can't really get by on less than that. There actually is a liquid formulation in Europe that is labeled for once a day, but we don't have that here yet. And one thing to notice, and people will see this if they know someone who's hypothyroid, the dog dose is going to be a lot higher than the person dose, about 10 times higher, because they just metabolize it different. So you can't really get the human supplements for the dogs. When we're doing the follow-up tests, it's really important we do a time test 4 to 6 hours after they take their morning dose. And that's going to be where the normal range has been validated. So if we can test them, we usually do the first test about 4 weeks after they start the medication. If we're having a dog that's having trouble getting regulated, we'll retest them every 6 to 8 weeks for the first 6 to 8 months till we get there, and then once or twice a year after that. The other important thing is that the sample be fasted. If we have lipemia in there, that can really interfere with the test and our ability to get a good result and see how they're doing. When we have concurrent diseases, so dogs that have heart disease, kidney failure, liver disease, the hypoadrenocorticism, which is the Addison's disease, the low adrenal cortisol hormones, or diabetes, we'll usually start them on a lower thyroid dose and gradually increase it. But it's really important to get that other problem taken care of before you try and get the thyroid regulated. Otherwise, you're going to be fighting between them to see what's the easiest thing to do. The other thing is to make sure you're sticking with the same medication. So if we typically like to use the brand name thyroid because they're much more bioavailable. so we know it's going to be consistent from bottle to bottle that we get. But if your vet's changing doses, or you go to an online pharmacy, or you switch to a different animal hospital because you moved, you're going to want to make sure that you're getting something that's the same as close as possible, or you may have to recheck those thyroid levels and adjust the dose based on that. So try and be consistent with that. And if you are having trouble regulating your dog, if they've been regulated for a while, ask your vet if they changed the product that they got. Maybe they didn't. We need to just reevaluate that, where that's going on. The prognosis with this disease is usually very good, excellent. We get the thyroid hormone supplement, most of the symptoms will just reverse and go away. If we're not getting good response after a few months, we need to start looking for some other problem, because there's something else going on other than the thyroid disease. So again, if your dog's overweight, and your vet recommends doing a test, go ahead and do it. If they say, hey, your thyroid levels are fine, you say, well, maybe we could do some other tests if you're really sure that that's going on. But if you've got any of these other symptoms, one of the other ones I wanted to talk about is increased drinking of water. If they're drinking a lot of water, that's often associated with it too. But the thin hair coat is very common, and the weight gain. Sitting by the warm areas is something that I always look for too. I'm always asking people.
Well, I always find that that's weird, considering that they're gaining weight, but their body temperature is getting lower. That's different.
So they're putting the fat on, but they're not burning enough to keep their core body temperature warm.
Well, I guess that's also part of the good thing about just doing that annual blood work that we talked about too, because our T4s are usually added on to that testing.
You're not going to do it in a puppy, but in an older dog, we're going to be checking that, and especially the older cats too.
Yeah, because it's always fun to see how the T4s do change throughout the years.
All right, let's move on to our news stories for the week. This is kind of a sad story, but I wanted to bring it up because it does have a very valid warning here. So there was a woman in Florida who's starting to warn other people about the dangers of toxic mushrooms after it killed her Boston Terrier less than 3 days after he ate it. And this was something in her backyard. And the dog went out, picked it up, and ate it before she could even think to try and get it out of his mouth. And it was about 2 days afterwards that he was unable to stand. He was grunting. He was having severe tremors in addition to vomiting and diarrhea. By the time they got him to the vet, they were doing supportive care, but there was nothing they could do in terms of antidote or getting out of the system. Had already been absorbed. He developed a pneumonia. The tremors never really stopped. And it was right before Thanksgiving that they ended up saying goodbye to him. So they don't know the exact variety of the mushroom that was there. There's certainly a lot of edible mushrooms that are going to grow, but I don't know the difference. Most owners aren't going to know the difference. So, check your yard periodically. Pull up those mushrooms that are coming up before they go out there so they're not there. Some dogs can experience symptoms as soon as 6 to 12 hours after ingesting mushrooms. It makes it difficult for the owner to determine if they were at the actual culprit. So the best thing is if they do eat a mushroom, call your vet, get them in. Sometimes the symptoms can show up within 30 minutes of the ingestion. So you want to, if you can get it out of them as quickly as possible, the chances of it causing problems are a lot less severe.
That also goes with the fact, always don't just let your dog outside, because you never know what they're getting into. You always want to make sure you keep an eye on your pet.
In your yard.
You don't know what's growing, what someone threw in there, what landed, heaven forbid, like a poisoned rat or something died in the yard, and now your dog got it. So you always want to keep an eye out on your pet when they're outside. Never leave them unattended.
All right, next thing I wanted to bring up, this was a cat food recall we wanted to let people know about. This is from J.M. Smucker. They have they recalled a bunch of lots of canned cat food because of potential health issues associated with ingredients that did not meet their quality and safety standards. They don't say exactly what's going on. It's the Special Kitty Mixed Grill Dinner Plate. And it's a wet canned food sold individually and in part of variety packs. So we put this up on our Facebook page. If you go to Facebook, search for American Animal Hospital around December 15th when the post was put up. That'll give you all the details. But so far, they've had not received any reports of cats being ill from this. But they're saying that whatever is in there could cause symptoms ranging from nausea and excessive salivation to diarrhea, vomiting, difficulty walking, seizure, and in extreme cases, death. So if you have this food, double check, make sure you got that out of there. They're encourage pet owners to contact their veterinarian if their cat displays any of these signs after eating this food. These products are sold online and in specialty stores, and grocery stores even. Like I said, we've got the link on Facebook. You can also just look up the JM Smucker cat food recall online, and that'll get you the information. If you have these products in your possession, you should discard them immediately. If you have questions, call the company at 888-569-6767. That's JM Smucker at 888-569-6767. And that's the Special Kitty Mixed Grill Dinner Plate. Again, check out the lots. We've got the lots and expiration dates posted on our Facebook page, so there should be no reason for you to be feeding that to your cat. All right, this last story is kind of weird because this is a warning from the FDA about a product that people use that can affect your pets. So there are these topical pain medications that contain non-steroidal anti-inflammatories or NSAIDs. And people applying them to themselves can actually put their pets at risk. So there's actually been several cases that brought this up. The most common one that's been associated with this is flurbiprofen. It's used to treat arthritis and joint pain, muscle discomfort, and other aches. It's marketed, and the brand names are NSAID and Frobin, and there's a generic. So if you see anything that has flurbiprofen in the ointment, the topical ointment, that's what we're talking about. And pets, especially cats, are being accidentally poisoned by this. Right? Cats are particularly sensitive to NSAIDs, so that's why we don't have a lot of non-steroidal anti-inflammatories available for cats. The only one we really have is Onsior, and that's only approved for 3 days, so it's not really a great one. We'll use some others off-label that we know are going to be safe, but always check with your veterinarian. The big one is Tylenol. Acetaminophen will kill cats very quickly. It binds to their red blood cells and damages them. Aspirin, cats will tolerate a little bit of aspirin, but they don't tolerate the same frequency. So before we had these other drugs, I used to give aspirin to cats every 2 or 3 days because it would just stay in their system that long. But if people gave it twice a day, like they would think a dog or a person would take it, that was way too much. So the FDA revealed that one case there was a guardian of 2 cats sickened by flurbiprofen that had recently used the pain medicine on their neck and feet. And they don't recall the cats even coming in contact with it or licking them, but they developed kidney failure, but they were able to recover with treatment from their veterinarian. So that's excellent. Another household had 3 cats that became sick after the owner used the products. Despite aggressive veterinary care, they did die. And they had to use this product prior to the cats developing the signs. When they did the necropsies on the cats, they did confirm it was due to the NSAID toxicity. So this is an ointment you just put on your skin, and then you may pet the cat. The cat may lick you. You may actually leave it on your sofa or your chairs where you're sitting, and the cat comes there and licks it there. It only takes a very small amount for cats to get sick. And most cats start to show symptoms within 24 to 72 hours. Dogs are less sensitive, but they can develop symptoms as well, especially the smaller dogs. So symptoms to look for: decreased appetite, reluctance to eat. So they will look at the food and they just kind of turn away. Lethargy, vomiting and diarrhea. Lots of things cause vomiting and diarrhea in cats, but if you're using one of these products and you see it, you need to be extra aware. Blood in the stool. So that can be a symptom of the NSAID toxicity, is bleeding in the gastrointestinal tract. Dark tarry stool, so that's bleeding from higher up in the digestive tract.
And
the blood gets digested, turns black and tarry. Abdominal pain, again that goes with the gastrointestinal problems. Anemia, so that's a test your blood's going to find on them. And increased thirst and urination, because it can damage the kidneys. So the ways to protect your pets: keep these medications away from your dogs or cats. If you apply a topical cream or lotion, avoid touching your pet for several hours and only after you've washed your hands or the area that you applied it to. Be careful contacting the couches and chairs and bedding with these preparations. And like I said, cats can be affected by very tiny amounts, and there may be a risk of continued exposure to tiny amounts over several weeks or days. So if you're very careful, a cat may be doing it.
And I don't think most people think that you put something topically on that it is really going to affect their pet. We had a cat a few years ago, actually, and cat's doing fine, so it's kind of funny now. We had an owner put on Nair, is one of the leg hair removal things. And the cat came up and rubbed the owner's leg. She wasn't thinking about it until she looked at her cat a few days later, and she was like, "Why are you bald on the side of your body?" And then she ended up calling here and asking, the vet's like, "Why is my cat bald?" And we were like, "We don't know. Bring your cat in." And we were like, "Wow, this is a nice smooth patch. Like, did you shave? What happened?" And Mom eventually remembered, I had Nair on my leg and the cat rubbed it. Luckily, the cat didn't lick it off as far as we know. We did blood work, everything. Right. The cat was fine. Cat's still doing great today. Hair grew back beautifully. But it's just those things that people don't think to, watch yourself when you're putting on medications or things like this, because your pet will come up and rub or lick you or something like that.
And you shouldn't be using these products on your pets.
No, not at all.
Don't use that. Don't use Nair, of course, but don't use these topical non-steroidal anti-inflammatories. Your vet we have specific ointments that are safe for animals, so please don't use that. And if you put flurbiprofen on your cat, you may regret that.
Yeah.
That may be the last thing that you do for them. All right, let's move on to our case of the week.
Yes.
And this is a cat, Simon. He came in about a week ago, and the owner said, "Oh, he just doesn't want to eat. He goes and just is having a tough time eating." And when they looked in his mouth, they saw a little bit of blood, didn't know exactly where it was coming from. When I looked in his mouth, he had actually sliced the edge of his tongue. Oh. So it's like a little tiny flap, a little corner of the tongue was kind of just hanging out loose. It was very red, and it was obviously very painful for the cat.
Yeah.
So we got him scheduled for surgery, but I gave him a shot of a non-steroidal anti-inflammatory, the Ansior. And they said, boy, within an hour of that, he was feeling a lot better.
That's
so that
good.
had to be very sore for him. But cuts on the tongue, it's a very dirty area that can get infected very easily. So when he came in, we had him out. We did a teeth cleaning on him. His teeth weren't that dirty, but I wanted to get him under for me to look at the tongue. And they said he had still been doing well, even though the Ansior shot was only going to last about a day. This was 3 days later. He's still feeling good.
Good.
And the area, there's still this little flap of tongue tissue hanging off, but the area was starting to look a lot less inflamed.
Oh, wow.
Hard to tell if it was infected, but you could see where the tongue was actually trying to heal both sides of the slice. So now we had this little flap of tongue that was sitting out.
So it was on the edge or in the middle?
On the edge.
Oh.
On the left edge of the tongue. It had this little triangle of tissue that was sticking out. So I could see that was going to be a problem with him chewing and that getting stuck on his teeth at points and him biting that. So we just basically trimmed that off. So now he's got a little defect in his tongue, but it should not affect his ability to eat or taste or anything like that. Just put a few absorbable stitches in there. Tongue bleeds like crazy, but once you get those stitches in, it stops pretty easily. So those stitches will absorb within a week, fall right out. And then he'll be fine. It shouldn't have a problem. I did give him another shot of the Ansior afterwards because I knew he was going to be sore from the surgery.
Did they say what they think happened?
I don't know. He might have bitten it himself.
Yeah, okay,
He might have been licking something that was really sharp.
Yeah, okay.
Sometimes I've seen that happen. I remember having a dog that had a big defect in his tongue. We don't know if he was born that way or if he had a cut, but it was like a forked tongue.
Yeah, that's what I was thinking when you said a cut tongue. I was like, is it a snake now?
So if your pet is not eating, we're going to always look in the mouth to see if the problem is there, because it may not be toxin exposure to drugs or anything like that. It may be as simple as that. I remember one cat we had that had a loose tooth that was preventing him from being able to close the mouth. I was actually able to remove that in the room because it was just hanging there by a little flap of tissue. But that cat was so thankful. All right, let's move on to tech tips. And this is something I saw. I was online, and they were talking about this harness for walking dogs and how great it was, and a handle and all these different features. So I thought, I bet that's something Brittney could talk about, and because we see a lot of dogs come into the clinic with these harnesses,
we do.
Not the collars anymore. So what are the advantages of these and the disadvantages, and why should people think about using one of these for their pets?
So a lot of advantages for using harnesses are good for especially smaller dogs with collapsing tracheas. So you cause less damage to the neck area.
That's a weakness in their airway that causes a honking cough, and when they pull on the leash, it just aggravates it.
It just aggravates it. We see a lot of little dogs that, before harnesses were a big thing, that would just be walking and then you just hear, and it's stop pulling on your leash, you're doing it to yourself. But now that they have harnesses, they can enjoy walks a little better. Some dogs actually do better with the pressure on their chest because it does keep them from pulling. And then for some owners, it actually works a little better for dogs too. If you have a big dog and they put on that harness and it helps keep them from pulling, you can actually take your dog out for a walk and enjoy a walk. A lot of harnesses do have, like you said, the handle on it now. And those, I think, are good for dogs, especially senior dogs. So we do see a lot of senior dogs with these special harnesses with the handle on it. So if they have weakness in the back from arthritis or bad hips or something like that, and they lay down or they slip on something or they have a hard time standing up, it does help the owner to have that extra pretty much suitcase handle to grab that and give that dog the extra lift up. Right. We use those a lot here when we have to hold dogs for restraint too, because it's easier just to hold that handle, because then you're not having to pull the leash or anything like that, because you actually have the dog closer to you with the harness and everything. The one thing I will say about some harnesses is that a lot of dogs are not trained very well on harnesses. Right. They have a harness on and they think that is free rein to just pull. And that's because a lot of people don't, they think, okay, the harness is doing good, it's better than, pulling on my dog's neck. But you also have to train them correctly for the harness, train them to walk with you, not to pull on the harness. We see a lot of large breed dogs that that would be working dogs, and for them you put a harness on them. Back in the day, they would, like huskies and malamutes, they would pull a sled, and now you have a harness on them. This is just work for them now. Yeah. So now we're getting pulled down a clinic, or you have owners that are getting pulled down a sidewalk, and we're just like, okay, maybe a harness isn't the best thing for you, or there are other options. Like
we talked about the choke collars a few weeks ago.
Yeah, or like easy walk harnesses. Yeah. Those are ones that actually buckle in front of the dog's chest. So when they walk, the leash is pretty much dead center in the chest, so it pulls to the side. So it keeps the dog, whereas the harnesses and that sit in the center of the back, you can't control your dog with that. That's like holding someone's shirt and saying, now you're mine. That's not going to happen. But if you can hold the center of the chest, that does keep the dog from doing a lot of pulling and keeping them with you better. And then there's just other harnesses that are good for crisscrossing for dogs that can easily slip out of harnesses. They make unslippable ones where as soon as the dog moves, it seems to tighten a little bit. And those are nice because we do have a lot of dogs that are smart and they know when they don't want to go somewhere, they just push their shoulders forward and the harness can just slip right over. Sometimes no matter how tight you make it, they can do that. Right. So harnesses, plus side, they're great, good for collapsing trachea dogs, good for a lot of dogs who are well trained on them. Right. Minuses, dogs, I've seen so many dogs slip out of harnesses, especially working in our field.
Make sure you get the right size and put them on properly.
Yeah, and then bring your dog to the pet store when you figure out that harness. They have so many different ones. Most pet stores, the associates there will help you fit one for your dog's size and for your needs. I go to Petco and I can see about 10 different brands of harnesses, and some of them are just to look pretty, and so they're not really like out there for function. If you have a big dog or even a little one and you want to actually get out there, you want a nice functioning harness, not one that's just going to look pretty. So I would bring your pet to the store and have an associate help you with that. And then most harnesses, even if you take it home because your dog doesn't do well in stores or car rides or things like that, if they don't work, most pet stores have a money back guarantee, right, or you can take it back and switch it for something else. Not many pet stores are going to say you're out of luck because you got the wrong harness. So always do your work before you buy something like this for your dog, because I have seen many dogs slip out of harnesses. You don't want to have to chase them down the street or anything like that. Or when you take them to the clinic, we have, dogs that don't want to walk with us to the back and they'll just slip out. And if you have another aggressive dog in the lobby or something, you don't want those two dogs to clash. You want to always be able to have control of your pet. If I have a harness, I would say the front walker harnesses are better, just because personal experience, controlling your dog from the back doesn't really work always.
So if you're looking for a harness, look for the front walker. Mm-hmm. Check with the people at the pet store, and then try it out. That's the best way to find out. Mm-hmm. All right, well, next week we're going to still talk about the thyroid, but we're going to talk about the hyperthyroidism, which we see in cats. So that's where we normally see that problem. And we'll talk about the diagnosis and the treatment and ways of managing that. So that's it for this week. I'm Dr. Jim Wilson.
I'm Brittney.
See you